Hello, everybody. Welcome back to another episode of Meaningful People Podcast.
How are you, dude?
Baruch Hashem, I am good. How about that episode last week from
Rivka Shotkin.
Rivka Shotkin. Which, by the way,
wow.
she is like, I think she's on a speaking tour already.
Seriously.
Shout out to all the listeners. You literally changed someone's life like overnight with that episode. Baruch Hashem, you know, she's a special young lady who Emerge Hashem is going to accomplish special things. We only saw a glimpse. We only saw here a glimpse in this studio. And listen, Emerge Hashem, we'll have more content from her one way or another.
Emerge Hashem.
Stay tuned. But this week we have an awesome guest on this podcast, Dr. Jonathan Feiner.
Dr. J.
The brother of Rabbi Eitan Feiner.
Right?
But the mindfulness guy.
Yeah.
He wrote a book on mindfulness and this episode
He wrote the book on mindfulness.
There's two of them. There's one by Dr. Benji Epstein and one by Dr. Jonathan
So he
Feiner.
wrote a book.
He wrote what's one of two? The books. I don't know. Well, we'll just go with it. He wrote a book on mindfulness.
Yes, he did.
And it's a very good one. So I recommend checking that out. But I love how this episode starts out with a meditation. And don't skip that because that is like...
Yeah, Dr. J invited us
to meditate.
To bring some mindfulness to the episode.
He did. It
was pretty legit.
So I hope you go ahead and enjoy this episode. But first, I want to talk about my friends at Aleph Beta. Aleph Beta is one of my favorite organizations. They create content better than any organization I know, even better than Meaningful Minute. What? You said that?
Beta.
Aleph better than Meaningful Minute.
There you go.
But are you looking to make your Torah study come to life?
Yes.
I sure am. Who isn't?
Yes.
You got to do that with Aleph Beta. So look no further. You go ahead and download their app, head to their website, and you can go ahead and get a premium account. Momo, I am killing this right now.
You are crushing this now.
No, I'm not killing it in a bad way.
No, but Aleph Beta happens to be doing some very, very cool things. Rabbi David Foreman, for anyone that doesn't know him, he sort of rethinks every episode in Tanakh that you're familiar with. He takes the occurrences that we all knew from a young age, and he really rethinks the scenarios. And he adds a layer of depth and a layer of insight to stories that we're familiar with, but insights that will blow our minds.
And that's why you need to go ahead and just give it a shot. And now is the best time to do that because now...
Give it a shotgun.
Wow, that's going to become a thing. Now for this week only, you can subscribe to Aleph Beta for $3 a month. For 3 months. That's $3 a month.
That's like a Black Friday sale.
That's 80%
on Aleph Beta.
That's 80% savings. Take my word for it.
80% savings?
Literally.
Whoa.
Take my word for it. Do it. And honestly, if you don't like it, then text me. I'll give you back your money.
Interesting.
I'll give you back your money. MOMO2. We're going to be broke. No, but you're going to love it. You're going to love it. And we have a promo code. Hit the link in the description in the show notes of this episode, and you will get that unlocked. I think the promo code is MPP 2022.
I think it might not be.
I think it might be.
I think it might not be, though.
No, because they texted me privately.
Oh, did they?
I think they did, though.
Okay, so it may or may not be.
And if it is, hit that link and you will get that discount. And now we will enjoy this episode. You are listening to the Meaningful People Podcast.
The podcast featuring our nation's most impactful, influential,
and meaningful people.
This is something usually I try to do anytime before I do any type of workshop or speaking type of thing, but also even when working with therapists, I encourage them to do that, both for myself to be able to ground myself and manage my own nerves when doing this, but also to connect to values and meaning. Because a lot of times we could be doing something meaningful, but we just get so pulled into the autopilot, we forget to find the meaning in whatever it is we're doing. So I find the following exercise could be a helpful way to start. If you guys are open to it.
Yes, let's do it.
See if we can just begin by taking a few deep breaths. So we could ground ourselves in this moment, to be present to what's here. Noticing the air as it goes in and as it goes out. And as you notice the breath, notice what is around the breath, which is the body. And take a few moments to notice how your body's feeling. You can notice the way your back's feeling against the chair. You can notice the way your feet feel against the floor. If you pay close attention, maybe you notice your heart pumping or the way your stomach feels. And it's about allowing yourself to feel whatever you're feeling. There's no right way to feel. And it's also about recognizing that so quickly we get pulled away from paying attention to whatever it is we want to pay attention to, and that's okay. It's part of what it means to be human. And the one instruction is each time you notice that you're wandering away from whatever it is you want to pay attention to, see if you could gently bring yourself right back. So in addition to the breath and the body, there are other things occurring in this moment, a lot of things that we may not have noticed, such as the sounds in the background. If you pay close attention, you can notice the sound of the raindrops. Something that's been here ever since we walked into this room, but we probably didn't notice it. In the same way that we can notice the sounds, we can also notice there's another noise occurring. That's the noise of the mind. So just take a few moments to notice whatever it is your mind is saying or doing. Sometimes we can have the thought, what is my mind saying? And as we're noticing the thoughts, see if you could, at this point, we're going to shift to a little more of an active mode of thinking, and to just take a few moments to think, what is important to you? Here we are, it's actually Erev Yom Kippur. But any day of the year, we can slow down and just take a few moments to ask ourselves, what is truly important to me? What is truly important to you guys? And notice what shows up with that. Once again, if you got distracted, that's okay. Just bring yourself right back to trying to pay attention to what is truly important to you. And at this point, to see if you can now ask, how is what we're doing now connected to what's important to you? Of course, this is called the Meaningful People Podcast, but even so, we need to ask ourselves, what can we do in this moment to connect to what is important to us? And how is this related to that? Whenever you like, you could feel free to open your eyes and just take a moment to look around the room, to notice what's here, what's right in front of us, things that we may not have noticed before. It's nice to see you guys.
How are you, dude?
Great. Baruch Hashem.
Oh.
Baruch Hashem. Thank you for that.
Sure, yeah. And thank you again for allowing me to be part of this.
Of course. If possible, if you could bring this closer, like as close as possible, that'd be great. Just want to make sure your levels are good. You don't have to hold it. You could just leave it. And perfect. Are you comfortable?
Great.
Okay.
It's good sound quality control.
Yeah.
It's great.
Yeah.
Wow. That was, okay, I never started an episode like that. Yeah. I think that we need a new ritual. We need to start all episodes like that. For those who are tuning in the middle of our conversation, we're joined by Yoni or Jonathan? Okay, that's the question. Dr. Yoni or Jonathan Feiner?
So sometimes I joke I have a little of an identity crisis, but the truth is, growing up, I was always Yoni, but I think like most Jewish boys on my passport, my legal name was always Jonathan. My guess is, I don't think it says Momo on your passport.
It does not say Momo.
It's not say Momo.
But it should. But it should say. It should say Momo.
Nachi's working on getting it changed.
You know, when I named my daughter Rosie, it's one of the things that, like, on her birth certificate, I didn't want, like, really, my grandma's name was Rosa, and she's Rosie, and I wrote on her birth certificate Rosie.
Nice.
And I wanted her to be, like, your name is Rosie. And I love the name Rosa also. I like that's her Hebrew name, Shkayach. But, like, I wish, my name is Menachem Mendel, but I'm known as Nachi. Yeah, people don't know that. I mean, some people do, whoever sits next to me in shul.
And in the studio.
And you knew that?
Yeah.
How?
You told me.
I told you straight up, like, hi, my name is Menachem.
No. I double clicked on what the name is.
Did you?
Sure.
I think you zeroed in on it, yeah. So I was just like, but it's always so hard because whenever I have to write legal documents, it's Menachem, but I'm Nachi, and it's like a lot. It's like when someone asks me, "Oh, what's your name?" Like, do you want my legal name? Or
right.
Exactly.
Like, it should be an easy question to answer.
So parents who are having children now, one name, normalize just going with on the birth certificate and in the classroom, one name. Yeah.
The truth is, the Jonathan, it helped because in college, I went by Jonathan, and I noticed even in high school when I had secular teachers, they would say Yoni sometimes.
Yoni.
Nice.
Yoni,
so Jonathan in college
famous,
worked.
Are you musical?
I'm not so musical.
Oh, that's tough to be Yoni without being musical.
You got the reference.
Yes, of course. Good. But it's spelled differently. The Yoni is, I think it's Y-A-N-N-I.
And you're Y-O-N-I.
Y-O-N-I, right. So then in college, I was already going by Jonathan to teachers. And then when I applied to graduate school, it stayed. And then I was in a secular environment at that point, and it kept up. And then when I started working in non-Jewish places, Jonathan was much easier. So then it became tricky when I started working again with the Jewish community. What do I go by? And
right.
I was already professionally going by Jonathan at that point.
And on your book, it says Jonathan.
Right. So that was also a tricky decision, whether to go by Jonathan.
You see the identity crisis your parents just thrust you in with Jonathan, Yoni, fine, and here you are. You're decades later just grappling with the name.
I think you're okay.
Thanks.
Are you?
I appreciate it.
Are you okay?
Doing okay with it.
Okay, great. So let's start off. Dr. Jonathan Feiner, thank you for joining us. People might recognize the last name, Feiner. And yes, your brother is Rabbi Eitan Feiner.
Yes.
You originate from the Five Towns, right around these blocks over here. And we had your brother on this show, on Meaningful People. He was actually the first guest ever on Meaningful People. And I think that the whole success of the podcast is due in part to him being the first guest.
Wow.
The idea of the show, of the program, is to have the vulnerability of people who, or people look up to and say, oh, that person's doing this and doing that, but to have them be vulnerable and share parts of their life that maybe they haven't shared before, that's your brother. That's our Eitan Feiner. So, 100 episodes later, I think we hit 100, by the way, which is crazy.
Seriously?
Either this,
wow.
we had 100.
Hey, wow. That would be as close.
Yeah, right? This might be 100, or last one was 100. I don't know, but...
You have good data on this, Nachi. Like, it's...
We could keep track.
Hofstra University.
It's definitely, Surly. What number? No?
Are you actually looking?
No. He's in the camera. But he's not actually looking right now. But, yeah.
Number 1 and number 100.
Yeah.
That's pretty cool.
So that's where we're at. So it's... what was it like growing up as a Feiner?
So Baruch Hashem, I'm very fortunate. I have wonderful parents, and I'm actually the 7th of 8. So I was on the younger end of the family. And
7th of 8.
Yes. So in addition to Rabbi Feiner, I'm fortunate to have a lot of wonderful siblings. Each one of them is really so special in their own way. And I was telling you on the phone when we were speaking that sometimes people say, is it annoying when people say,
yeah.
And the truth is, it's such a zechus. I'm honored to be his brother. And I think one of the reasons why sometimes people have a hard time when they're known by a certain family member is, in addition to the fact that people want to have their own identity, but sometimes it's the person says, if only you really knew this person, then it's a different story. And I have to say, when it comes to someone like my brother, he wouldn't want me to share too much publicly on this podcast, but as much as people see him on the outside, his inner life mirrors his outer life, and even more so. And the older I get, I realize even myself, I will have only limited access to him, in the sense that there's so much more to him that most people don't see, that I don't even see. And Baruch Hashem, I could say, really Toho Kiboro, that he truly lives every day trying to just be the best Eved Hashem that he can be. And I have to say, all my siblings, they've all been tremendous role models for me, and living life trying to just serve Hashem to the best of our abilities.
Beautiful.
Wow.
That's so nice.
And you grew up in this neighborhood, I think.
Yes. I was saying, I just came from my parents, got the pre-Yom Kippur bracha.
Yeah.
And it's nice to be back. I davened tomorrow by the White Shul.
Oh, wow. Very nice.
Which, I don't know, did he mention on the podcast that we actually grew up in the shul where he's the Rav?
I don't think if that came... I mean, he may have. he may have joked that he was sitting there while people were making comments while the Rav was speaking, and then he never knew that he would be there one day being the Rav. I don't know. I don't recall. Maybe he did. But you're here tonight because you're doing incredible work, important work. You wrote a book, Mindfulness, The Jewish Approach, and you are, holding it up for the camera. Thank you, Momo. Or maybe it's that one or that one. Which one?
Who knows?
Who knows? We should have good data on that also. Mindfulness is something that I've learned to love, and I think that it's probably one of the most important skills to have to be, I think, successful as a father, a husband, professionally. I think
a human.
Like,
yes.
I think it is. I think Momo agrees.
Absolutely.
And I love discussing this topic. And we had a guest on, Dr. Benji Epstein, who you actually went to college with.
So we went to the same college. We actually even went to the same camp when we were younger. So I remember.
Which camp was that?
The Camp Morashah.
Okay.
So he was a few years older than me, but I remember he was already a popular guy back then. And then we went to the same graduate school, and a lot of these graduate schools, they have very small classes. So I was in a class of 13 people. So you really got to know everybody who was in the program. And there weren't that many from people. So he was in some ways like my big brother in the program. Yeah. And we were both, I think, inspired by the same professor that got us each into mindfulness. Back then, mindfulness wasn't yet a popular term or something that was used much in psychotherapy. So I started graduate school in 2007.
And mindfulness then was not.
It was just slowly starting to become part of mainstream psychotherapy. It could be in general society. It was slowly.
That's so strange. Introduced. Like, that's so strange to me. Like, I have this new podcast with my father called Daily Thread. We discuss like what's going on, like in the Jewish world. And one thing I spoke to my father about this morning is like, sushi didn't become a thing until like what, 2010?
Really?
No, 2005. No, is that not true?
I don't know. No, I have. But I don't have good information on this.
So my father said there was no such thing as kosher pizza when he was growing up until he was around.
Pizza.
Kosher pizza did not exist. There was no.
I'm not
pizza.
that old. Wow.
No, you're not. But my point in saying this is that, like, what were people doing before there was kosher pizza? What were people doing? Like, what did Lakewood do before there was sushi? Like, they just had charcuterie boards, no sushi, by Kedushim. Shout out Lakewood. You know, I love you. But 2007 for mindfulness to just start being like introduced, I feel like is a little late for society, you know?
At the same time, some were saying that as society picked up its pace and people are living such fast-paced lives and technology, the fact that that's having... So it actually makes sense. In some ways, the refuah came as the same time as the makkah. So some will argue that it started becoming so popular because people need it more now than ever before.
So how, like the kosher pizza thing, people just got hungrier? Like, I'm curious about that. Like, one guy's like, you know what, I need dough, sauce, and cheese right now. So, something like that must have happened.
You're committed to that parallel construct.
Is it not? Is that our theme right now?
I guess maybe your next podcast, you got to find the first guy who opened the first kosher pizza store. So
my father said it was Shopsy. I said, what's his last name? He's like, not sure. Shopsy. Shopsy from Utica. But like, crazy.
Here I think there was Sabra's and Pizza Pius.
I found this book in my apartment recently. I don't know who got it for us. It's like the history of the 5 towns in Faroukaway. Like, this is like, what am I looking at here? I open up.
From Yeshiva of South Shore.
Yes.
The Kamenetsky family.
Crazy book.
My great uncle.
Yes. Hello.
And Rabbi Binyamin Kamenetsky.
He's your great uncle.
Yeah.
Wow.
And I'm just like, I look at the pictures. I'm like, oh my gosh, Sabra. And also they had
It's a very cool book, by the way.
I'll bring it next time. Yeah, part 2 of this. But Toddy's, they said, opened in like 19. I don't want to botch this, but Toddy's, the Todman family. For those who don't live in the 5 towns, are like, okay, what are you guys talking about? There's a famous bagel store called Toddy's. It's been here since 1980 something, and it wasn't a kosher bagel store. But when the community started becoming more frum, they became Shomer Shabbos bagel store to cater to the frum community. And they took on
until now I never knew what Toddy's
Todman, right?
Wow,
Todman. Who would have known?
How are you, though?
Yeah. How do we get to that? I didn't think I'd be talking about Toddy's in this podcast.
You got there from 2007 mindfulness to when pizza started to the history of the 5
That's
towns.
a really messed
Let's
up.
bring it back to mindfulness, though.
But actually, see, that's the nature of the mind. The mind wanders so quickly, and it's amazing.
It's pretty messed up that we got there.
And next time we're davening Shemona Esrei, just notice how quickly the mind goes from one thing to another.
Yeah, wow. That's like the best ideas come during Shemona Esrei. I think everyone says that. So the area in which you practice in, that you have a practice.
Right. So even though I grew up in the Five Towns, I'm currently living in the Muncie area. It's actually New Hempstead, nice. But nobody knows of New Hempstead. So I just say I'm from Muncie, and I have both a small private practice, and I work as the adult clinical director in Achieve Behavioral Health. For those that aren't from Muncie, it's one of the largest behavioral health centers serving the Jewish community. A lot of people aren't as familiar with it outside of the area. Mm-hmm. But Baruch Hashem, it's led by, there's Dr. Yuti Schechter. I don't know if he's a wonderful psychologist. I'm also a very close friend and mentor in many ways. And he, along with Mr. Aaron Reiner, started this behavioral health center we actually, I think by the end of the year, we're expecting to have served almost 7,000 patients.
Wow.
So it's a big operation.
What's
so I work as
in terms of
so I work as the adult clinical director there, overseeing a lot of the adult services.
It's a lot.
It is. But I have work with a great team. It's a lot of wonderful people.
What's the range of, I guess, things that people are coming to get to achieve?
So it could be anything. Unfortunately, there's severe mental illness, psychosis. There are people showing substance abuse, and then we also have cases where people just relationship issues, anxiety, depression, OCD, and my private practice is mostly focused on anxiety and OCD. But in terms of the behavioral health center, it could be anything that anybody would want to go see a therapist or psychiatrist for. And there's unfortunately a lot of people struggling, but we're trying to do what we can to help.
So let's discuss anxiety and OCD for a minute. I think that maybe is it fair to say that in the Jewish world our life is just our schedule, our Yom Tov, everything. Jewish life is just, we're more prone to anxiety and OCD.
So actually, years ago in the clinic that I wasn't working there at the time. I worked there years ago. I did my internship there, but Dr. Schechter collected data over the years, and what we found is that the Jewish community has a higher prevalence of anxiety, but lower of depression than the general society.
Really?
Which is actually consistent with what you're saying.
I love stats, right?
I do.
Just keep throwing stats.
Okay.
That's an amazing.
If you want to get more specific data to you at some point.
It's an amazing.
But we do find,
So we're more anxious, but we're less depressed.
Anxiety, exactly.
Why? Like, what's the?
So there are different theories. One theory is, and what we also actually found was the more insular the community, the anxiety is even more. And one theory is that larger families and life cycle events create a certain tension. Another theory is what we call like the fishbowl effect, when everywhere you go, people know who you are, and it creates a certain anxiety with that. But there are a lot of benefits to that. Sometimes being overly anonymous could lead to feeling lonely and left out. So it balances out.
You gotta strike a balance.
Yeah.
It's interesting.
Yeah. And like all data, you have to take it with a grain of salt. It's, this is just based on a certain amount of data collected in the clinic.
Right, especially in an insular community where there's reporting bias.
Right. But what we did was, it was based on the diagnoses that came to the clinic. Mm-hmm. So we compared that data to what we would see in a secular clinic.
Oh, so this study was driven by data within your clinic. Wow.
Yeah.
That's very cool.
It is very cool.
Yeah.
And you explained some of the theories on the anxiety side. I presume on the depression side, it's because of meaning in the community?
Religion is a very protective factor when it comes to emotional health, community, meaning. And once again, these are all theories, but I think it makes sense that religious people, we do find overall, are less depressed than people that are not religious.
Mm-hmm. I want to utilize the opportunity that this episode is to sort of shine a light and normalize and empower our listeners that might be struggling with anxiety in particular.
Yeah.
And I noticed something interesting. It happened when you listed it as well, but I hear it very often when people make a list of things that people are dealing with. So they'll talk with like a lot of gravity when it comes to like substance abuse and domestic abuse. And like, those are like the serious, severe things. And then like they'll start like, and anxiety and right. And like it becomes like the lighter issue. And I think it's important to empower the community to know that when you're suffering with anxiety, it's not an easy thing to be dealing with. It's not a lighter issue on the spectrum. And if a person's having a panic attack, or if a person is experiencing garden variety anxiety, it's a very, very real issue. And I think it's important to shine that light and to really empower our listeners that if you're suffering with this, there are tools and there's ways to address it.
For sure. That's such a great point. And it's clearly on a continuum. So yes, you have people say, oh, that's OCD or I have a little anxiety, but there are cases where it's taking over their lives. And this is a lot of the work we're doing. And I apologize. I didn't mean at all to minimize
No.
The people that I work with, many of them, anxiety and OCD, it is something that can truly take over somebody's life. And when it comes to emotional pain, that you can't measure it. There's a saying that sometimes, pain of the mind is worse than pain of the body. And for those that haven't experienced that, it's hard to understand what that means. But for those that have been there, they understand that's why. And unfortunately, people sometimes choose to end their lives when the pain gets so great, because it could be so severe. And independent of whatever the diagnosis is, you can't ever measure somebody else's emotional pain.
Mm-hmm. So let's take a minute to sort of educate.
Yeah.
Right.
Mm-hmm.
What is anxiety? Right. It's a term that is thrown around a lot.
Mm-hmm.
What is it?
So are you familiar? There's something called the Diagnostic Statistical Manual, DSM. Okay.
I was about to say, don't give me a DSM definition.
See, what happens is it's gone through different evolutions.
Right.
And in the old one, it was basically included, actually, OCD used to be considered an anxiety disorder, along with even PTSD, post-traumatic stress disorder. You had social phobia, social anxiety, and then there was also panic disorder, general anxiety disorder, specific phobias. And there's a category. It's hard to give a general definition. However, in the new DSM, they just changed it up a little so that OCD and PTSD are different categories. But the primary feature is that a person's experiencing a certain pattern of thoughts, certain things in their body, and it's leading to certain behaviors, usually avoidance behaviors or different types of compulsive behaviors to try to manage it in an unhealthy way. It's hard to give a general definition, but I hope that clarifies it to some degree. And what's also most important is that the treatment is what we call transdiagnostic. And in simple terms, basically means it doesn't matter so much what the specific diagnosis is, because a lot of the same techniques that are helpful for one will be helpful for the other. And I think I shared with Nachi there. I created a summary sheet. I'm not sure if you ended up getting it. That goes over a lot of what the main techniques are in terms of the ability to manage the thoughts, the sensations, and the behaviors that the person is struggling with.
Mm-hmm. And that avoidance that you're talking about, or the compulsive, I know there's an expression that people talk about, fight or flight.
Right.
Does that follow the same
Totally.
paradigm?
See, what's really happening, if you want, I could go more in detail. When
Sure.
I'm trying to think the best way to describe this. The metaphor I sometimes give is, let's say, if there's a lion that we're to enter the room, so our amygdala, it's the part of the brain that tells us to be nervous and do something about it. And that's a good thing. We want to be able to have such a reaction, and that will help save our lives. What we call anxiety is when it's not a real lion. It's, let's say, a picture of a lion, or the person's thinking about a lion. And what's happening is your brain is giving you that same reaction that you get when there's a real danger. Mm-hmm. Like I was even telling Nachi that sometimes when doing these things, and even now, I get a little nervous. Mm-hmm. And what's happening from a logical perspective, if this podcast goes horribly, so it'll be embarrassing, and I'm going to be obsessing about this the next hour or two.
You have to move, so we'll relocate you. It's not a problem.
But it's not going to end my life. But what happens is, my amygdala, sends the alarm signals like, danger, or something bad may happen. You may say the wrong thing, and you're feeling something that in many ways isn't logical, but it's a natural reaction that's occurring. And when people hear this, it's actually very validating.
Yeah.
It's helping them realize that it's not like you're thinking anything incorrectly or there's something inherently wrong with you. It's just that the brain is overly sensitive when it comes to certain things, and that you're reacting as if there's real danger when there isn't. Or, well, some say it's not just a false alarm. Sometimes it could be a magnified alarm, something where there could be a little issue and it feels so much bigger than it needs to be.
That's so interesting, because I totally can relate to what you just said. And I feel like if a lion were to walk into this room, I'd probably feel more relaxed and calm and react better than having to do some of the things that I'm nervous to do or scared to do, let's say public speak or, or anything else.
It would not be Pasha, dude, if a lion walked in.
I
based
really,
on the exits, would not be Pasha.
First of all, I got 2 doors.
I'm not trying to make you anxious right now. But
I can think more with a clear mind than I could if you told me you need to speak in front of 200 people. Like, I can game plan right now. Okay, if the lion walked into this room, and I'm not anxious discussing that, but if you told me that you have to go speak next Shabbos in front of, I would like get all sweaty and start freaking out.
Right, and maybe that's because you relate to that as a real world issue. Like, you're not hardwired to even know what it's like
to be with a lion in a room.
To be with a lion in a room. Like, you don't know what that fear even feels like.
Maybe that'll
it's so removed from your reality.
Maybe that's like the biggest way to solve anxiety is get people in a room with a lion and just like, this is how it, like.
Right, but is the technique to give it the right sized role as a fear? Like, if people are magnifying it or just drumming up, the nature of the issue.
So there are different parts. So I'll try to give the summary of what the treatment is, but one part is being able to recognize whether it's a magnified or a false alarm. But even so, and what I write on the sheet is that's not going to take away the feeling. So a person could tell themselves logically it doesn't make sense or it's not dangerous, but the amygdala already send the signals out to the body. In some ways, it's too late.
So what do you do?
So at that point where people get stuck is it's like, so I'm nervous. And remember, it's the same signal you get when there is a real problem. So you start feeling like, I shouldn't be feeling this way, and you start fighting it. And that actually makes it worse.
Mm-hmm.
I'm so happy we're discussing this. I want to really just like go through it, because for the people who are listening who experience what you're talking about, and I bet there are people who are listening who experience what you're talking about and don't even know there are words to what they feel. And they could be younger, they could be older, it doesn't matter. So I think it's so important that we have this.
Sure, no, I'm so happy to. And we actually know that over 25% of the population at some point in their life will meet criteria for an anxiety disorder. That's pretty high.
25%. How many of them go undiagnosed?
That I don't have the data in front of me. But actually, I remember seeing it. I think it's over 50%.
We'll go.
Well, look at your clinic. Your clinic is from the more active clinics in our community. And we're very excited that you were able to treat 7,000 patients. How many more people are there in our community living in the Muncie area?
I don't know. That way. Here's the thing. Like, I don't know if I've ever met a frum Jew that doesn't have anxiety. I'm serious. Everyone who I get to know on a deep level and speak to is like, they're like, it always boils down to, yeah, like, serious, I'm really anxious and I had a panic attack last night about this. I'm like, oh, like it's.
Yeah, there's also a bias. I'll just call it, once we're analyzing data, I'll call it a bias that your friends are your friends for a reason. And you're very outspoken about mental health and about taking care of oneself.
I don't know.
So there's a very big bias that people are going to share with you that experience.
I object.
But I'm not discounting the reality in our community. It's extremely prevalent.
So you would agree with Nachi's term of every single frum Jew has anxiety?
Everybody experiences anxiety at some point in their life. Whether it's going to meet criteria for a diagnosis, that's a separate question. But everybody at some point is going to be nervous and anxious about something. I mean, even coming out of Corona, most people were nervous to some degree. And it's really asking,
how disruptive is it to their life?
How disruptive. And also, as we were saying in the case of the line, there are certain anxieties which are adaptive. What we call modern anxiety disorders, where it's just not helpful. We need to come up with a different way to cope with it.
Right. We'll be right back to this episode. But
back.
Tovito.
Interesting.
Tovito. This is one of the most exciting ads that we were zeicha to get. I was rhyming until I wasn't.
Oh, you were crushing it.
Yeah, but Tovito, you're watching this video on YouTube right now, maybe, or maybe you're listening to this, but if you're on YouTube and you're a parent, you're like, okay, I'll put the episode for my kid on YouTube, but you know what? I hope they aren't looking on the side because God knows what type of videos are popping up on YouTube. But guess what? There's a website that has content for your kid that you can trust in, and that is Tovito.com.
Tovito.com.
Tovito. And Bubby's, Zadie's, Ima's, Abba's, Hanukkah's coming up.
It really is.
And you don't have to buy a gift for all the kids separately. Just buy Tovito. Get them a subscription, and we can give you 15% off.
Or buy a gift for each kid separately and buy Tovito for the parents for their kids.
Okay.
Right?
That works. We could do that. Sure.
Don't encourage people to not buy presents for their grandchildren. That's what
Momo is going to buy all of your kids' presents, and Momo's number is... So yeah, Tovito is a great gift for the whole entire family. So go ahead, head to Tovito.com. It's on most, I think, smart TVs, obviously websites. They have their own app. I love Tovito. I use it. My daughter loves it. And as a family, it's great. They have an amazing content. And we're not talking about
keep it fresh too.
It's not nerdy.
They upload new content.
Yeah, it's not nerdy stuff. It's 3D
animation,
yeah.
live action.
It's like straight out of Disney.
It's really, it's stellar content.
So go ahead.
And it's kosher content.
Again, if you don't like it, I'll just give you your money back. No big deal. Just call me or call Momo at 917.
People have to know that he's joking when he says that.
Which one? The money back part?
Yeah.
Is there fine print in a podcast? Who cares? Go ahead and use promo code MM15 for 15% off Tovito.com. Now back to this episode. So now that we laid, laid that foundation, someone's feeling anxious and it's about something that doesn't make sense to them. Like, let's say they have a fear of traveling, right? Mm-hmm. Or they don't have a fear of traveling. They're just on a coach bus, and all of a sudden they get really nervous and they're looking around and their heart is beating fast. And they're like, why am I getting like this? I'm just on a coach bus traveling, Mm-hmm. And then, like you said, the
amygdala.
Yeah, right. That doesn't help them by saying, well, something's wrong. What does that do?
So the one thing that's occurring that we may say is a little wrong is the fact that their brain is firing too much.
Right.
But that doesn't mean that they're in a real dangerous situation. So step one is helping them recognize whether this is, as we were saying, magnified or not. And what's also interesting is as the amygdala is active, the front of the brain, the prefrontal cortex, is actually shut down. And that's why when a person's emotional, they're just not thinking clearly. And take the extreme example of this is anger. When a person's angry, they can be thinking thoughts that don't make any sense because the logical part of the brain is really shut down. And it's similar with anxiety. It's hard to think clearly in those moments, but what you could tell yourself is the fact that I'm emotional means I can't fully trust whatever my mind is saying. And therefore, the next step is to clarify, okay, so the person that I want to be, how would he behave? So if I was a more relaxed person, or if I wasn't experiencing this anxiety, what would I want to be doing in this situation? Does it make sense for me to get into the car or to give this speech or to do this or whatever it is that the person wants to do? And then after that, it's about recognizing where you feel it in the body. And this is actually where mindfulness comes in some ways, where usually what happens is the person's trying to fight it, to say, okay, I need to get rid of this or come up with some trick or tell myself the right thing. But in many cases, that's going to backfire. It's like if I were to tell you, Momo, for the next 30 seconds, try not to think about a pink elephant.
Yeah.
Do you usually think about pink elephants?
Never.
All
okay.
Day. I just can't.
Until you tell me not to.
Exactly. So why is that happening? The more we try not to think about something, the more we're going to think about it. The more we try to tell ourselves, don't feel this, don't think it, boom, it's going to come right back at you. So where mindfulness comes in, it's about saying, okay, let me see if I could be compassionate toward whatever I'm experiencing right now. And as I said, even as I'm sitting here, I am experiencing some anxiety in the body. And the key is, okay, it's okay. I'm allowed to feel this. And when you really hone in on what it is, it actually becomes less threatening. Okay, so it's this tightness in my chest or this feeling in my throat a little, or wherever it is the person's feeling. When you view it with compassion, it becomes easier to manage. And those are really the few main steps. And that's more in the moment of what you could do. And then there are many things not in the moment, right, such as exposure exercises, cognitive therapy. And
I find that if you encounter someone who's having like losing their temper and they're angry and they're mad, and what's the worst thing you could say to them in that moment?
Just calm down.
Relax, calm down, right? So someone who's like having a panic attack, going crazy, and like the worst thing is like just chill. Right? So that's not the route.
That's not constructive.
Exactly. Don't be nervous. Or even I'll say, before coming here, but my wife says, okay, just be yourself. And it's like, of course, I want to be myself. And it's still, from her, it's helpful to hear.
Right.
But still to say, she's actually also a therapist. So she knows not to say, don't be anxious or don't. It's like, it's okay if you're feeling that way. And that's one of the most comforting messages. You're saying you like data. I'll actually, if you want, I could share a cool study. This was they did at the University of Washington, where they took a bunch of students and they divided them into two groups. And they had them solve these really difficult math problems that almost everybody that would be doing these math problems would get frustrated. And they also hooked them up to these machines that can measure their stress level and blood pressure. And to one group, as they're doing these math problems, they say, guys, don't be so nervous. Don't be so stressed out. It's just silly math problems. And boom, what happened? Their stress level goes up.
Really?
The other group that's getting stressed out, they say, it's okay. Most people get stressed out. It's okay if you're getting stressed out. Their stress level went down. And then the question is, what's the message that we tell ourselves?
How do they measure the stress level?
So they have these...
I thought you were going to say that they got more answers
They were
correct.
No.
They all
I'm trying to think
better.
back to... They probably did perform better. I have to look back at the study to see that part of it. But they have, I forgot these specific tools that they hook up to their fingers that can measure
stress levels.
And also the cortisol levels in their saliva.
Wow.
But the important lesson is also like when we get stressed out, like what are we telling ourselves? Like, I shouldn't be nervous. Boom, we're going to feel worse. So it's like, well, it's okay.
Given the data that we have, it's kind of amazing that we all make the same mistake, and on a person to person level, but also like on institutional level with teachers and also parents. Like, if we have data that shows us that in a stressful situation, the worst thing to say is this, like, why do we keep doing that as society?
I'll actually share with you that Tiferes Yisrael on the Mishnah Avos, Al Tenachameyu B'Shas Kaso, he actually says this very idea. He says, if you try to tell somebody don't be angry, they're going to get angrier. So I think the reason why many people have that response, it's their own way to feel like they're doing something or they're trying to help. And I think in most cases it's coming from a good place, but they just don't realize that it's going to be ineffective.
Mm-hmm. It's like you think that water is going to put out, a grease fire, but pouring water on a grease fire makes it a lot worse.
Right.
So let's help people not pour water on grease fires.
Yes,
Dr. Yoni. We want to give our listeners tools and the greatest thing that can come out of an episode like this is just people being more educated and having more tools in their tool bag on how to recognize in their life what's going on and how to, I guess, better treat it.
And so I guess one of the main messages is it's okay to feel whatever you're feeling. At the same time, though, that doesn't justify inappropriate behaviors. It's one thing, to feel something. That doesn't mean you could respond with anger. Mm-hmm. So even when we say, don't be angry, that can mean, two things. It can mean don't feel it, but it could also mean don't act according to that. And that's something at the end of the day, we could usually control our behavior, our feelings, our inner world. We have much less control over and limited. And this is actually a whole hashkafic discussion in terms of how much we could really control our thoughts and feelings. That's, maybe if you want to do another podcast at some point. So to say the simple approach is in the moment, it's very difficult. There are things you could do not in the moment that I think can make it less likely for you to experience those emotions in the future. But that's a big avoda. In many ways, it's lifelong avoda.
Well,
how do we regulate ourselves?
What are some things that someone could do that can, help them in the future? Go to therapy.
Yes, this is a discussion in terms of how much to bring religion into therapy, but I guess this is a Jewish podcast, so I could say it that there's a tremendous value to learning Musar. we do find that's one of the best ways to remind somebody of what's truly important and why I should not behave this way when I'm angry. If somebody were to tell you, if you respond with anger, there's going to be such and such consequence, that's going to affect the likelihood of you responding in such ways. So if you just learned the Musar Sefer telling you how harmful anger is, I do believe over the next hour, you're less likely to respond as long as you're maintaining a certain level of mindfulness.
Interesting. It's a counterintuitive response that a way to prevent anxiety is to learn Musar about the
things
negative
that invoke anxiety.
Right. There's a lot of discussion, at least from communities where there's religious trauma about, especially during this time of the year. Yeah. And I was hoping that would be a topic that we got to. Maybe it's relevant to what you're saying now, but it opens up another discussion. And you are doing so much work within the Frum community. And you did mention that it's difficult to sort of, bifurcate religion from clinical treatment.
Yeah,
bifurcate.
But at the end of the day, we are from Yidden, living from lifestyles, and just listening to people on the street. You hear about religious trauma and the anxiety approaching days like Yom Kippur that we have coming tomorrow night as we record this. And there is a lot of that trauma and a lot of that anxiety about a fear-based religion, and people don't have that loving relationship with the Eibishter. And there's a lot here. Right. And what are you seeing, at least in your practice, with, let's bring it just to a practical level. What are you seeing in your practice that is being helpful to people that need a little bit of a realignment within their Yiddishkeit for a healthy Yiddishkeit?
So you're making, great points. And I guess to take a step back, I'll first, clarify when I was saying the idea of learning Musar. And with everything in treatment, it's going to be so tailored towards the individual client. And I was speaking more about anger. When it comes to anxiety, it is a little trickier. And the most common question that arises is like, where does bitachon fit in? And one thing I think is important to mention is that sometimes people feel if I'm anxious, that means I don't have enough bitachon. And I think that's a very incorrect statement. I've seen, Rosh Yeshiva and people that I think are real balei emunah bitachon that have had panic attacks, that struggle with bitachon. So the fact that somebody's struggling with anxiety, I don't think it's a reflection on their level of bitachon. However, that doesn't mean that bitachon can't be helpful.
Right.
It's almost like if you were to say, when somebody has strep, it's not because they don't have enough antibiotics, but that doesn't mean antibiotics can't still be helpful for the strep. So bitachon, the role of bitachon...
It's a very geschmack of mashal.
Oh, thanks.
Put that in your toolbox.
Yeah.
I'm sure he'll use it next episode. We'll credit you.
So bitachon, in some cases, what it's really doing is helping the person clarify what is a real fear and what isn't in different circumstances. And it could be comforting. I'll be honest, even actually a half hour before this podcast, I tried to learn something specific just to remind myself, betachal Hashem b'chol libecha v'al b'naschal tishain, that we have to have bitachon in Hashem and not rely on our own understanding. And that was definitely, comforting for me. Did it take away that feeling in the body? Not necessarily, but it was still providing a certain amount of comfort. So bitachon can be helpful. As a psychologist, I have to be very careful about bringing that to a client, and because people are usually, coming to me, not, as a psychologist, not as a mashgiach. So rarely will I actually introduce that to a client unless it's somebody that I think it speaks to where they're at. As a psychologist, where we need to, focus on what are the evidence-based strategies. And there actually is a study showing that the bitachon can be helpful for anxiety. So it is actually an evidence-based strategy, I will say. But, to go back to what you were saying about, OCD and this time of year, I usually tell people that where we see an increase in the people coming for OCD, scrupulosity is actually the term for religious OCD. So I usually see an increase a little before Pesach, and the Yamim Noraim.
Really?
That's where I usually see, a few more of those cases, because you're correct that Yiddishkeit, can sometimes, I think, incorrectly bring that message to, here, I guess I'll clarify it, a little further. Many years ago, when I was in my Shana Aleph in Yeshiva at Kerem, it was very intense during Elul Zman. And when I went to Rav Blachman, or Mendel Blachman, to wish him a good Yontif, he's like, Feiner, the shofar's blowing, the trumpets are going, chill out a little. And for me, that was such a helpful message, because I was in some ways, too serious then. And I needed to hear that message, like, it's okay to chill out, to find that balance. Yet I can imagine that the guy who was maybe next to me or coming to him later, he may say, like, come on, it's Rosh Hashanah, like, take it seriously. And we have to know what each person needs and wants in the moment. And what's right for person A may not be the right message for person B. And sometimes with some of these guys, I tell them, when the Rosh Yeshiva is giving those Mercer Shmuzin, like, they may not always be meant for you. It may be meant for the next guy. Right now, you may need that message that you need to be a little more balanced. You need to maybe take things a little more chilled out. And usually when we speak to the Rebbe or the Rosh Yeshiva, they're very on board with that. And they realize, yeah, when I gave that fiery Mercer Shmuzin, it wasn't meant for this guy. It was meant for the 70% of Talmidim that needed to hear that. So we have to know what each person, the messages that they need to hear. And
that's so interesting. That's like really interesting, because like growing up, I always, I wasn't a great student, and not going to delve into how much I learned in high school or anything at all. But I was like, I was just what I call like a regular kid. I was, having a good time. And then you see like these guys who are just like really intense and serious, and they always made me nervous. Like what is going on? And it's nothing against people who are serious, learning and academic, but then there's someone who is just like, I feel like I want to make a statement here. Maybe I'll retract it. Maybe I won't. I feel like I have to find the right words for this, but someone who perhaps is struggling socially could be viewed as excelling academically in Yiddishkeit, because the less they are part of the chevra, the less they are doing things that are normal, playing ball or just integrated in with the guys, the more they're like looked at as, oh, this guy he doesn't even eat breakfast, he just learns. He doesn't even eat lunch, he just learns. But I think as time goes on, we're seeing that that's not necessarily a good, healthy thing.
Are you saying that I think you're
trying to cancel me right now?
No. I'm trying to give you the terms you're looking for.
Please.
I think you're taking exception to glorifying unhealthy behavior.
Yeah. And I think Y.Y. Jacobson speaks about this. Rabbi Y.Y. Jacobson, I think he has spoken about this specifically, about like glorifying unhealthy behavior and like glossing it over and defining it as.
But I think what I'm hearing from Dr. J, if I may, is that healthy behavior is not the same for every patient.
Right.
And right?
So if I may say, you could have two guys in yeshiva who are very intense, and for one guy, it's working for him, while for the other guy, it may not be.
Mm-hmm.
There are actually certain criteria which we look at to differentiate what's considered somebody who's just, machmir in a healthy way versus where it's coming from a place of OCD. And one is, are they starting to become resentful? Another question is it limited to certain areas of religion? So if this is a person now who's dominating so long that he's creating problems for his family or for other people, if it's something that isn't consistent with what the Rabbanim in the community recommend and what the halacha truly is, so those are things that are alarming factors as to what may be OCD. And in general, just going back, I think Judaism is really somewhat, and life is all about balance.
Yeah.
I mean, if you read the Rambam in Hilchos Teos, just talking about we need to be balanced people.
Do we have? I want to like hammer home at this.
You got this, dude.
I'm so canceled by now. Do our yeshivas, do our institutions encourage balance, or do they encourage learn 18 hours a day? Live as much as you can. Go this route. Do they like? Does religion encourage the balance?
Were you asking that question?
Hey, wow. Now you're getting to the sensitive topics here.
Yeah, it is a sensitive topic, but like I think somewhere someone is listening, going, yeah. Maybe my wife, but that
Shirley Besser's not.
It's really why am I? I'm not.
Wasn't
I'm not,
this a whole debate?
Yeah, Shirley's the defender of the yeshiva bachrim.
I'm not saying anything against yeshiva bachrim. I'm not. But I am. I do want to put the conversation on the table of if encouraging. a behavior, a mold, right? The cookie cutter, and saying like, this is what we all should do if that is healthy. Is that healthy? Or should we be more open to, encouraging other behaviors?
It's hard to paint with such a broad brush.
Right.
But that's what we do. We do paint with a broad brush.
That's
just
what
one
you're
way.
doing right now.
No, that's what we do as from Jews. Is we paint with a broad brush.
Do we though?
I mean, I don't know.
Let's shift back to Dr. J.
He's on the
who
hot
was
seat.
kind
Why do
enough
I
to
feel
come
like
into
I'm
the
hot?
studio this evening.
If it's okay.
Let's do this.
See, every yeshiva is going to be different.
Mm-hmm.
I need to take a moment to think how to respond to this. Both obviously what's going on in my mind, but also one has to be careful.
Yeah,
with
that's a lost art. What he's doing right now, everyone should know. It's a lost art.
You wait.
He's thinking.
You ask yourself, why am I talking?
Yeah.
And you wait. It's an acronym, so it has to be true. Why am I talking? Wait.
So if it's okay, actually share with one of my brothers, just share with me a good piece of advice. He was saying that one of the things he's learned in his many years in this world is that if a person's unsure of whether to say something or not, it's usually better in the moment not to say it. And he's saying, later you can either look back at it and say, okay, I should have said it, but it's worse if one looks back and say like, oh man, I should not have said that. So if it's okay, because it is such a sensitive topic touching on such important issues in the community, sure. And I'd rather not respond. Not that I don't have my own thoughts on it, but I would want to make sure to clarify them further before saying something in a public forum.
Of course. What I'll do, which I think will empower you to share your expertise.
He's an attorney.
But also address the point that Nachi's driving at, shifting the focus away from our institutions, from our yeshivas, which are all being led with Das Torah that is completely hailing and doesn't need to be questioned.
I approve that message, and I did not question it.
And I think the question that Nachi's driving at the core is speaking to a specific yeshiva bacher. How would you advise that bacher to introduce balance into his life? What are the tools available to him in a yeshiva setting that he can incorporate into a healthy lifestyle?
So the first is I have to be in touch with the people in his community that he looks up to. I have to make sure that my own biases aren't affecting the things I'm sharing. So for example, let's say I'm working with somebody in a very insular community where they may not be playing sports much. It's not necessarily my place to say, oh, by the way, I think it would be great for you to start going bicycle riding or playing certain sports if in that community that's not accepted. We may need to find what are some other ways that he can have a healthy outlet in a way that's consistent with the values of his community. So I always have to work with the values of the clients that are sitting in front of me. And one of the ways I do that is by speaking to them. Who are the Rabbanim that you look up to? Who are the poskim in your community? And I need to be in touch with them to try to figure out, okay, what are things that we can do for this specific client to help, achieve that balance? And for the average yeshiva guy, I'll be in touch with his Rebbe to figure out, what to do. And most Rebbeim, when I speak to them, they'll say, yes, this guy should be exercising more, and it's okay if he needs to take a little break from Seder every now and then. But I usually will only do it once I'm speaking to the specific, Rebbe or Rosh Yeshiva that they're in touch with.
We'll be right back to this episode in just a second. But first, a quick word. Oh my gosh, more
right back.
Oh my God. Happy Halloween.
Right back.
Okay. But we want to speak about our friends at Touro. And the trailblazer that we're featuring this week is one that you maybe know, and that is Naomi Nachman, the Aussie.
How are you, Naomi Nachman?
She's a multi-talented woman resident, Naomi Nachman. She's born in Australia. And guess what? She's sold over 28,000 copies of her popular Perfect Flavors and Perfect for Pesach cookbooks.
Wow. With over 40,000 followers. How are you?
40,000 followers.
Good.
And where'd she start out that journey?
Touro University.
There's nowhere else. Like literally every successful person in the world started at
Touro University.
Or Harvard, but mostly at
Touro University.
So go ahead and you know what to do. Become a trailblazer. Head to 50.touro.edu and you will see I nailed that. 50.touro.edu, and you'll
Love
see
it.
how, either you become an Instagram star or a chef or own coach, or not like coach like the airline level, but like the clothing company. We spoke about a guy who's he did
Brand president.
The brand president. But all this can start for you at Touro University. So go ahead, go to Touro, and if you don't like it, Momo will just give you the money back.
How did that become a thing? Seriously, dude.
We have some serious legal ramifications here. We're going to have Momo. What's tuition?
Nahi offered basically money back for any dissatisfaction related to anything we said on this episode. Nahi is refunding your money, apparently.
Nahi may have or may not have won the Powerball recently.
Interesting.
Enjoy the rest of this episode. In terms of a parent seeing their children, because I think shifting away from the institution is a smart move, because we have a big glass window here, and we don't want it to be full of paintballs or stuff. But
inherently, it's
not. Yeah,
it's the right thing. Not only because of consequences.
I will say though, I think another.
I was also like, could you just walk around with me everywhere? Anytime I open my mouth, just to be there.
Wow.
No,
we all had someone like that.
I cannot.
We should all have a Momo.
Yeah, we all need a Momo. We're gonna make like little stuffed Momos. Like we're gonna sell them.
Do not do
Yes,
that.
can we make a bobblehead of Momo?
I will beg you
not
to do that.
One important message I think that I do feel comfortable sharing is that people need to realize that Avodas Hashem comes in so many different forms, and that if somebody's struggling in their learning, and I'm okay sharing, I actually myself, I had a number of years that I was really struggling in learning, and it was very hard for me to accept, because if the message is that the only way to serve Hashem is through learning, you feel like, what am I? And I needed to internalize, and my brother was definitely helpful, always telling me over and over again, like, Yoni, like Hashem just wants you to be the best of Hashem with whatever is in front of you. And if right now you're not meant to learn or you're meant to do other things, that is the Ratzon Hashem. And I think that is an important message that I think everybody would agree with, that if somebody's struggling in their learning, that doesn't make them less of an Eved Hashem. Sometimes, if anything, that's where they can grow in other ways that they wouldn't have been able to grow otherwise. I'll just, use myself. I would never have become a psychologist if it wasn't the fact that Hashem brought certain challenges to my life. And, in the moment, obviously, it was very difficult. And when there were times that I couldn't learn, I did sometimes feel less than the average person. But at the end of the day, true Avodas Hashem is whatever Hashem gives you. That's, and you're doing your best with whatever is in front of you. Ultimately, that's just as valuable, if not more, than whatever anyone else is doing. As long as you could be honest with yourself and say, I'm truly trying my best.
Yeah, I think that's a beautiful message to our listeners. I don't know the data on this, Nahi. Maybe you know how many of our listeners are Yeshiva Bachrim.
Well, for this episode, they will be.
But I think there's such a large faction of Klal Yisrael that need to be empowered to know that even if their full-time thing they don't have the opportunity and the ability to sit and learn full-time. And for those that do have that avoda, it's a moiridige zach, and that's their avoda. And for those that have a different role within our ecosystem of Yiddishkeit, there's also avoda to be doing the entire day, not only during the hour that you're being kaveh itim laTorah. There's avodas Hashem throughout your entire existence, right?
I was going to say, I wish I could record that, and Baruch Hashem, it is recorded. I believe Rav Aaron Lopiansky actually wrote a beautiful book, Ben Torah for Life, which is touching on these very same ideas. And I think it is important to continue to have that ratzon to learn, and even for myself, like there continues to be this part that I would love to be in the base medrash and to be able to learn more at the same time. That's not necessarily my avoda at this point in my life, and I think exactly what you were saying. People have to recognize that whatever they're doing, you could be finding Hashem in whatever it is you're doing. And I guess in some ways, actually, that goes back to the idea of mindfulness, not to keep on bringing it back to that, but it requires a certain ability to tap into whatever. When I'm drinking a cup of water, when I'm sitting with a client, when we're doing a podcast, hopefully it could all in some ways connect back to Avodas Hashem. The challenge is just to be mindful of that when a person's with their crying child in the middle of the night. Like, that's huge.
Like I saw somewhere, or maybe it was even on Rosh Hashanah, but Zach Katinsky was speaking in shul, and he had mentioned that during shofar, if any of the children are making noise, you take them out, because the avodah for you in that moment is to take your child out. And I saw it, and I think I forgot who I heard say it, but Yom Kippur, a lot of mothers, wives are going to be home with their children for the vast majority, and that it applies to Yom Tov and Shabbosim. And you might think like, oh, I'm not by Kol Nidre, oh, I'm not by Ne'ilah. No, but your avodah in this moment is to be where you are with who you are. And I think something I personally, and I think that's where my question came from, something I struggled with in high school, and is that like I haven't had a ton of success in learning and in high school, and I did feel like, second class. I did feel like, if I can't be that, learner, and even, when it comes to shidduchim, it's like daunting. It's like, I don't know. I feel like the chips are stacked against you, because, the learner, it's whatever. It maybe falls to the top of the pile. Whether that's the truth or not, it's definitely what was something I was grappling with. Only later in life, in my wise years, in my 40s, did I begin to, be introduced in a different way to a Yiddishkeit of, where you are and who you are with the kayach that Hashem gave you. And I think I just think that maybe people can resonate with the way I felt.
And Baruch Hashem, you're now doing wonderful work, helping out Klal Yisrael.
But I'll still feel like that sometimes. Not as much as I used to, but I still will feel threatened and intimidated. And it's not in any way, I think, because what anyone else does. It's just I think that I don't know.
It's part of the avodah.
Yeah.
What is part?
And it's important
to work through that insecurity.
And at least for myself, it was helpful to have rebbeim over the years that would keep on reminding me of this message, because you're correct. In certain environments, that's not the message that's relayed. And sometimes that will need to be balanced, whether it be through certain svarim or rebbeim, to give you that chizuk when you're in those moments, to say, no, like, you're not a second-class citizen. Like, as long as you're doing whatever you can to the best of your ability, like, everybody could be like Moshe Rabbeinu in that sense. We could all be our best selves. It's just a matter of finding what is that avodah.
Yeah.
And sometimes it could take time to find that. But in many ways, as long as we're trying, there's meaning in the now with that.
When you say we could all be like Moshe Rabbeinu, I think you might be alluding to a very well-known idea that sometimes the Torah says Moshe ve'Aaron, and sometimes it says Aaron u'Moshe. And Rashi brings the Maimer of Chazal, Malamed sheshkulim hein, which teaches us that they were equal. How could it be that Moshe and Aaron were equal? The Torah says, like, Kam bi Yisrael ke Moshe od, that there was never a Jew in Klal Yisrael ever like Moshe Rabbeinu. So how could it be that they're equal? And I think what you're alluding to is that they're equal and that they each maximize their potential.
Exactly. Actually, if I can, I could share another, I think, beautiful way to read that Rashi, the Medrash, is the Lashon, I believe, is actually sheshkulim ka'achas. So what does that mean? They view themselves as one. When you view yourselves as connected to other people in Klal Yisrael, it doesn't matter, who's, like, we're all one team.
Wow.
That's another way, I think, to read that Rashi. Sheshkulim ka'achas. My brother, it doesn't matter if, he's higher. We're one. We're on the same team here. It's like if my left arm is, feeling better than my right arm, it's all one. It doesn't make a difference. Sheshkulim ka'achas.
Somebody who, is listening big in this episode, and they hear the issues, and they identify with a lot of things we're talking about. I want to sort of insert mindfulness and how can someone start living more mindful?
One is even just taking time to just sit and to be aware, which unfortunately nowadays is becoming more and more challenging. My guess is, what do most people do the moment they finish davening? What's one of the first things they do? What would you guess?
Check their phone.
Check their phones, right?
It's if they haven't been checking their phone during davening.
Right. Or when a person, wakes up, or because of devices, people don't have time anymore to just be with themselves, or even in the car. You could have somebody who's, listening to, one thing, eating something, and also trying to pay attention to the road. we've lost that ability to just be with ourselves. And I think one important and one great place to start is just giving yourself a few moments to just do nothing. Because in some ways, that's actually, that's everything. I think we're missing out on so much because we're always thinking about, the past and the future, but life is happening right now in this moment. And if we're not paying attention to that, we're really missing out on life.
When I started Meaningful Minute in 2017, I was talking about this recently because, like I told you in our call, Meaningful Minute's taking on a new project called Pause, which is sort of a, introducing mindfulness and meditations into the front world, and on social media and places like that. And I felt like in 2017, the Avodah is, chap another minute of Torah. Like, you listen to this, take it in, good. And I think that, and that still applies for many people. But I do think that for many, many people in 2022, it's like, if you have a minute to do anything, maybe don't do anything. Like maybe just do nothing. And I've been seeing more and more of these things of like, do nothing for 30 seconds. And it makes you laugh for a second. Like, what does that mean, do nothing for 30 seconds? Of course I could do nothing for 30 seconds. And you realize that you really can't do nothing for 30 seconds. It's really difficult to do nothing. Yeah. But that message of just, in our fast-paced lives, and you had mentioned that people don't like to be with themselves and they don't like to think by themselves. I recall being by a speech once. Rabbi Wawa Jacobson was speaking, and he got up to the podium, and he was just sitting there, and he was just quiet, and he was putting papers, and I was getting anxious for him, just cough, do something into the mic, make it you acknowledge that you're in front of a crowd. And he just took his time organizing papers and doing his thing up there. And I was just, it really, and to be honest, you're doing the same thing tonight in a way where I'm you're responding, you're reacting, you're thinking. And it's it's such an amazing thing to see. And it's a breath of fresh air to realize although we live in this fast paced world, normalize just taking it slow and responding in your own speed, in your own way, at your own time. And just if someone says something, you don't need to react that second, whether it's a text, a phone call, a podcast.
Right. I'm just going to pause for a minute.
But you see, silence became awkward. It can't be silences. What's the worst thing on a date? Silence.
Mm-hmm. Someone, when I was dating, actually, someone gave me a really cool piece of advice. My wife is the first girl that I dated.
Wow.
Didn't know that.
Yeah. And what you just said resonated with me a lot about avoiding silence. And our third date was a step down after 2 good dates.
Always is.
And it was we were, oh my goodness, right? And so I prepared topics to talk about on the 4th date. And my wife shared with me later that she also did. So we both came to this date all ready to rock, topics of conversation, avoiding any lulls of, right? No, there will be no silence. And later on in our dating process, someone advised me, you're ready to get engaged when you're okay just sitting in each other's company. And you don't need to fill the room with anything. Just with your presence. When you're comfortable in that presence of each other's company, you're cool being together.
It's beautiful.
And that is mindfulness.
Right. I think you could take it even further though. And what I like to think is one of the ways that Yiddishkeit, Judaism, influences the practice of mindfulness is that we could bring values into it, where it's not just about slowing down. And slowing down is important, and I think that's the first step. We need to slow down to be aware of what's happening to ourselves, where our mind is. But then we can take it like the exercise we started with to ask ourselves, what's important to me? Years ago, I was reading, there's a great article by Rabbi Jeremy Kagan in the journal Dialogue, where I think the title of the article is great. It was Media, the Modern Day Gathering of Straw. And what he was talking about in this article is that one of the ways that Paro kept Bnei Yisrael busy was with this easy labor. So he asked, why straw? Give them hard work. Because sometimes it's the easy labor, it's the phones, the easy stuff that a person could be constantly busy with. And I think nowadays that's so applicable, recognizing that people have the ability now to distract themselves almost every single moment of their lives. I was once sitting with a client and I had to just walk out for 30 seconds to check on something. And, the moment I walk out, I see, boom, the phone comes out. Like, why is that? That the moment we're not doing something, we have to go right back to the phone. And it's also another discussion. I think that the fact that we're constantly busy with devices also has a severe negative impact on our mental health. So much of our emotional processing occurs in those moments when we're not doing other things. And if you don't give yourself that time to just stay with your own emotions, it's going to end up coming out in unhealthy ways. So there are many different benefits of being able to just slow down. And obviously it helps relationships. It could help emotions. It's now used in a lot of the Fortune 500 companies to improve work performance.
So interesting. I think that I feel like we challenged it on a different episode, but it's a good challenge for the peeps. And I'll start with myself and you, Momo. Is I think we had mentioned once, if you're on an elevator and just you're in an elevator with 3 other people and it's just it's awkward, you just sit in an elevator and it's quiet, or don't take out your phone.
You know what I'll do on elevators sometimes? In the city, in Manhattan, now they've put
Is it the city's Manhattan?
City, yeah, New York City. Okay. This is an international podcast, dude.
Global.
In New York
People
City.
on Mars.
I only discovered this when going to Muncie, that the city meant Brooklyn.
Right, during the summer
in
the mountains. Brooklyn means the city. I love that.
Right.
So yeah, in New York City, they put screens in all the elevators, right? So that now either you have your own device or there's a device available for everyone.
God forbid, In
case you don't have a phone, I guess. I don't know.
The gas stations.
Exactly, at the pump. So sometimes in an elevator, I'll just stand next to a person and be like, hi.
Yeah.
Hello.
Hello there. How are you doing?
When's the last time you were in a waiting room?
Yeah.
How many people there are not on a device? It's amazing.
So your call to action here is just to be with yourself and to notice moments in your life when you could just be in the moment, just be here and don't just reach for the phone and the phone is I feel like the phone here is a metaphor, because before it was phones, it was something else. Let's be real. The generation before the phones also had
it's also the phones.
For sure.
It's also mainly the phones.
I know, of course, but it's all let me discuss it. In the 1940s, they didn't have mental health issues.
And we heard from Dr. J that this issue has become more of an issue.
For sure.
Right. We're definitely seeing a rise in the constant distractibility. People, I even have I have a sister that teaches in our Yisrael, a brother-in-law there, and they've mentioned that they actually see over years the difference in the students, that they're having a harder time paying attention. And we actually have data to back this up, that people are having much more difficult just staying in the moment, paying attention. And if I can add, I think we're at a point now where everybody realizes there's a problem, and
we're all okay with it.
Or even those that are not okay, I think we also need some real practical solutions. Yeah. What do we do with this? And 2 things that I recommend as good start, or 3 things as good starting points, is one is I think there is a benefit if people want to try to find a few moments to just be, but we also need certain guidelines for ourselves in advance. If we just let life go as usual, the phone's very powerful. I'll tell you, I'm somebody, I speak about this stuff. I try to practice mindfulness, and I too get pulled back into the device. The stimulation is intense, and it's much more reinforcing in the short term than just being with oneself. So one needs to create certain guidelines for themselves. So let's say I have a certain client, he says after 11 o'clock at night, he won't go on any device unless it's something that's truly an emergency. Or other people will say, okay, a half hour, I don't check my phone. I think people need to create guidelines in advance. If you just wait to the moment, it's going to be too challenging. So those are 2 pieces. Another piece that I'm not as familiar with these things, but somebody said even if you just take off the notifications on your phones, that will stop half the problem.
It's true, like a do not disturb.
Right.
I think there's a lot of practical points and things that we discussed in this episode.
I have a practical challenge for our listeners.
Okay.
We have a challenge noise.
Try it on for size. See how it grabs you.
Go.
Yeah. So they sell alarm clocks.
No, they don't.
They do. They really do. Because everyone says, I can't shut my phone. I use it as an alarm clock.
Yeah.
So there's totally a solution for that, right? It's called a good old-fashioned alarm clock. People love it when you use it. And the challenge is to just shut your phone at night. And if you're able to like not go to sleep right away and have some waking time without the phone, even better. But I find even just that I shut my phone before I go to sleep, game-changing, right? And then in the morning, you can build. Either if you need to turn it on right away, turn it on right away, like baby steps, right? But over time, you'll see that maybe you don't need it right away. Maybe you can have some waking time in the morning too, before you engage with everything that your phone connects you to. Start your day by connecting with just what's right in front of you. And maybe you go to shul in the morning, maybe you don't, but maybe you're present for a little bit before you're totally connected to everything not in your presence.
It's huge.
Well said. Sometimes, people say, but I may miss out on something, the FOMO, the fear of
like
missing
what if there's an
out.
emergency and someone needs to reach me? How many times has someone tried calling me at 3 a.m.? It's like that's what right away you said that. And I said, I can't. I don't have a house phone. It's me and my wife. I'm supposed to shut my phone off overnight.
Like, you just walked into it.
Right.
Okay,
But I just
challenge you
answered
to get a
myself.
house phone.
No, well, that's dumb. No one
It's not dumb. It's smart.
if someone
You don't
is
have
gonna
a
call, no. If anybody is 26 and has a house phone, I'd like to speak to you. You have a house phone?
Yeah, and 6 children.
Okay, that's why you have a house phone.
Right. I guess once you have
House
kids,
phones are like not a thing anymore. Just like I remember growing up.
Dude, make it a thing.
Just telemarketers.
Meaningful Minute wasn't a thing either until you made it a thing.
You know what? First of all, I want to say something. The alarm clock challenge.
Alarm clock challenge.
Momo will be paying for your alarm clock.
Interesting.
If you want to make the move.
Uh-oh.
And I'll tell you, because Meaningful Minute ran an initiative during a Sarah Smith Tshuva, and it's going to continue, God willing. It's called Tefillah Before Tech. It's a program we do every year to daven before you look at your phone. And the biggest thing is, my phone is my alarm clock. My phone is my alarm clock. And someone responded to one of the things. Anybody wants an alarm clock, I'll pay for their alarm clock.
There you go.
So you want to go ahead. You want to say that I can. It's my alarm clock. Momo Bauman will pay for your alarm clock. And anywhere up to $20 per alarm clock. You could email him at
Meaningful unauthorized.
meaningfulpeoplepodcast@gmail.com. Put in the subject Momo alarm clock.
Okay.
And
You're challenging me to do that.
I'm challenging you.
I accept that.
That if someone can't bring themselves to purchase the alarm clock,
Done.
I think, you know what, Meaningful Minute might have to make alarm clocks.
They might.
We have to make alarm clocks. But
really curious how many emails you're going to get now.
I'm really curious too, by the way. I'm going to get the whole Northwood marriage just like we need alarm clocks, But that's, I like a lot of challenges in this episode, and a lot to think about. And that's what we want to encourage is more thinking.
Yes.
And we also want to encourage people to pick up this book, Mindfulness, a Jewish approach. I'm in the middle of it, happens to be. The ladybug on the cover is like the most mindfulness thing in the world. Shout out to Mosaic.
A lot of thought went into that ladybug.
Did it?
Yeah, it was a whole question. I actually only later discovered. Do you know what ladybug is in Hebrew? It's a Paras Moshe Rabbeinu. It's considered Moshe Rabbeinu's cow, but
That's what it's called?
yeah. I think it's Paras Moshe Rabbeinu.
Wow.
Yeah.
Why?
Yeah. Why the ladybug on the cover, or why is it called Paras?
Why
Moshe?
is it called Paras Moshe?
So there's a complicated explanation.
I'm here for it. You don't have to say
Yeah.
it. We'll leave it at that.
What about on the cover? Is it noticing that it's there?
So it was only after that I tried to come up with a deeper explanation. I initially was thinking, to maybe have a butterfly.
Yeah.
Because what a butterfly represents, caterpillar
Yeah.
is something that through patience and time, you could take something and make it into something beautiful. But it just doesn't look as nice on the cover. And I trusted
I'll tell you the meaning that I assigned to the ladybug. When you walked us through the mindfulness practice before we started the episode, it was my favorite part of the practice, where you highlighted the sound of the raindrops.
Yeah.
And you illustrated the reality that it was there from the moment we walked into the room. Right. And we were in here for minutes.
Mm-hmm.
And then all of a sudden you called our attention to it, and it was so loud.
Right.
And like you might not notice the ladybug on the cover.
What you give the
until
voice?
you
Exactly.
notice it.
That's exactly what the publisher said.
That's awesome. Go for it.
It connects actually to what we were speaking about before, the FOMO, and that I may miss out on something. And I tell people, you're familiar with this halachic concept of bari v'shema, bari adif, which is that if one person has a claim of certainty, the other has a claim of maybe, the certainty wins out. And I say, when it comes to the fear of missing out, you're correct. You may miss out. But because of that maybe you're missing out, you're for sure missing out on something so much more essential, what it means to live in the present moment.
Nice.
And people are correct. Yes, you may miss an important message every now and then, but if you're going to constantly live your whole life for the fear of missing out, you're going to be missing out on something much more important than that.
Wow. That's a perfect way to end this episode. Okay. Dr. Jonathan, Yoni, thank you so much for joining us.
Once again, thanks so much for having me. And you guys should have a meaningful and mindful Yom Kippur and Gemar Chasima Tova.
Amen. Amen. Thank you.
I hope you enjoyed this episode of Meaningful People. I sure did. I feel very calm. I feel very relaxed now. Maybe because I just meditated. Maybe because I'm sitting next to Momo Bauman.
Oh, that's so kind.
It's the glasses.
Now he's being kind.
Yeah, be kind. By the way, be kind still. You can go ahead and order that merch still at meaningfulminute.org.
Right?
Because being kind doesn't stop when we go push it like crazy. Being kind is forever. So be kind. Go to
and we rise by lifting others. And
we do.
And we're mindful of our kindness.
We are.
Thanks to Dr. J.
Yeah. And if you don't want to be mindful, if you just want to be crazed and just be focused on what's going on in the world every second, you can go ahead and follow the Daily Thread, because that's what we do. We're just, me and my dad, we shoot a breeze every day. We talk about the news stories that'll probably make you nuts and make you mad and make your blood boil. And we also have a new WhatsApp status account, so that link will be in the description over here, where we constantly update you throughout the day how angry you need to be with what the stock market's looking like or what Donald Trump said that you don't like. Anyways, that's the Daily Thread for you. This is Meaningful People. I'm Nachi Gordon. This is Momo Bauman. This is a phone. This is some spritzly seltzer.
Calling it like he sees it.
This is an empty cup. And you have yourself a great day.
Thank you.
Hope you enjoyed this video from Meaningful Minute. We have so much more content for you. You may like this. You may like this. Take your pick. Let us know what you think.